March is designated National Women's History Month. Joining me today is Dr. Cherie Allen. She is the first African-American nurse in the state of Tennessee to be certified in plastic and reconstructive surgery. Welcome to Take 10 on Tuesdays with the Tennessee Tribune. I am Deniece Barnes. Dr. Allen, welcome to Take 10 on Tuesdays. How are you?
Thank you. I'm well.
Great. As I said in the introduction, you are the first African-American nurse in the state of Tennessee to be certified in plastic and reconstructive surgery. First off, I want you to let my viewers know more about you, Dr. Cherie Allen.
Okay, I am a registered nurse here in the state of Tennessee, Massachusetts, and Indiana. I just completed my doctorate in nursing in acute critical care at UT Memphis, and I am very happy for all the things that I have that are coming my way. I have several positions that I have been offered, so I'm going to take the next 2 or 3 weeks to decide on which position best fits me. I am a 100 Black woman. I believe in being very vocal and active in the community.
Well, that was actually leading to my next question for you. Being an African-American woman in the community, what impact would you say that you've made in the community?
Well, I think first as a mentor. I believe that when I was growing up, I had a mentor, my mom, and then also mentors that she encouraged me to be involved with. And I think it's very important that I bring other young African-American females along and encourage them to do the things that they need to do to become successful.
Dr. Cherie, to me, I take that personally because mentoring is very, very important.
Yes.
As I say, our youth are our next generation, and it's very important. How important to you, Dr. Allen, is role modeling?
I think role modeling is very important, but the most important part is to pick the right role model. You have to know what values that role model has. I started mentoring a young lady when she was 8 years old, and she is now 19, and I say I am still mentoring. She has entered college. I think that she has to emulate what she sees me doing. So you have to be very positive, but also sometimes you have to be stern and letting them know that you do know what the youth are going through today, and you recognize that, but still you have more knowledge and skills on how to help her get to where she needs to be.
I concur absolutely, Dr. Allen. And one thing that I would say is, you mentioned the children, you have to be an example, you have to listen. Communication to me is very vital. Listening and having a shoulder, if you will, for them to lean on is very vital as well. So I commend you on your mentoring our youth. Okay, now I want to talk to you more about the African-American women and the 100 Black women in the Metro-Nashville chapter. Yes. Tell us a little bit more about your position there.
Well, currently I'm the second vice president of programs, and I'm responsible for all the programs that are initiated and started, and to start new programs that are compared or mirrored our mission, which is health, education, and social economical welfare of African American women in this community. We just had a very successful conference. Our annual Sister for Sister conference was very successful, and from this we were able to mentor, or we were able to reach over 250 young women on health, social, economic, and education. One of our initiatives, which I am proud to say, we are in conjunction with Belmont, we're starting our Women on Boards, where we will train African American women in the community to be on boards, which I think is vital, because as we want to be change makers, and so we have to be where the policies are. So I think one of those places are on boards.
Dr. Cherie Allen is the first African-American in the state of Tennessee to be certified in plastic and reconstructive surgery, and March has been designated as National Women's History Month. One question that I have for you, Dr. Allen, is would you say that African American women have accomplished many successes? I know that you've accomplished many of yours, but do you think that we've overcome a lot and have a long ways to go still?
Yes, I think that's twofold. I think we have accomplished a lot. We have come a long way. I still think that we still have a long way to come, but we know where we want to go and we're not letting anything stop us. And I think that's the most important thing, that we keep going and never say that we've accomplished or we've made it, because you always have a long way to go.
Absolutely. And one thing that I have to say is, you've never made it. You can always use wisdom, and someone can always tell you more to do or give you that advice. Yes. You know, you and I, but we definitely have a long ways to go. We've made it so far, but in other words, you know, we're not above wisdom.
No, I'm always striving. I mean, education never stops. You always need to better yourself. And I think the most important thing is that you don't stop. Don't let anybody stop you. There are new things out there every day. You always need to, you know, broaden your horizon. So as far as a long way to go, yes, I feel like I have a long way to go and I've come a long way. But I do think that I am now in the position where I can further that vision that I need.
Now, Dr. Allen, the National Coalition of 100 Black Women is a marvelous organization. How can my viewers learn more about it or maybe become a part of this organization?
Well, we have a fabulous website. You can go to Nashville100bw.org and you can read all about our initiatives, our activities. We also have applications if you are of interest, if you want to fill out an application of interest. We do have meetings monthly, but our meetings are for members only. But you can find us out in the community anywhere. We are a partner with the Meharry Women's Center, and so we're testing for HIV. We're at diabetes. We're trying to disseminate information in the community about diabetes. We have mentoring for Girl Scouts. So any event that you have out there in the community, we try to like tap in or add a little piece of us to that.
Very good. Again, I commend your organization. You're doing great things, and I know you're going to continue to do great things in the community. Dr. Cherie Allen, again, first African-American nurse in the state of Tennessee to be certified in plastic and reconstructive surgery. How hard was that for you to accomplish such a feat?
Well, I think it started when I was in nursing school. I was at Tennessee State University, and one of the instructors there told me, oh, you have to go and work on the floor first. That's the most important thing. And I'm like, well, that's not what I want to do. So when one of the plastic surgeons in this area, he contacted our school and said that he needed an intern. And so I was like, So I applied for it and I became an intern. And after school, I did 2 years of training, and then I sat for an exam. And my training consisted of assisting human surgeries in the hospital, running the office, ordering tests, evaluating tests, and we also had clinic. I had to suture, I had to do bandaging, and I had to also learn about wound care. So after all that, then I took the certification test and I passed, so I was very excited. But I did not want to be the only one. I felt like this was an area that could be broadened to all African American nurses. And throughout my years, I've been trying to encourage, it's hard to tell someone, well, it's 2 years of training and you got to do call in the ER and you're going to see a lot of trauma. It's not just the foo-foo, the microdermabrasion or the injections, it's, some of it's like breast cancer. We do a lot of surgery on breast cancer. So it was hard to get someone that was going to spend 50% of their nursing in 2 years for this cause. And finally, I encouraged a nurse. She's an African American. She sat for her boards in October and she passed. And we are good friends, and I am very, very excited for her. And I'm still encouraging her. Okay, what's your next step? And she's like, oh, I need a break. Oh, there's never a break. 2 or 3 weeks. what is your next step? So I'm always encouraging her to continue her education.
Absolutely.
And to ask, I said, you don't have to leave it, you know. I chose to do that because I saw a bigger picture for me, but you always have to be thinking on what is my next step.
Absolutely, Dr. Allen, and again, I commend you for all of your works. You're reaching back, and if anything is worth having, you have to work hard at it.
Yes.
So you are a positive role model in the community. Hats off to you. Again, March has been designated as National Women's History Month. My guest today is Dr. Cherie Allen. I have learned over the years that when one's mind is made up, this diminishes fear. Knowing what must be done does away with fear. Rosa Parks, African-American civil rights activist. March is National Women's History Month. Again, Dr. Cherie Allen, thank you so much for joining me on Tech 10 on Tuesdays with the Tennessee Tribune.
My pleasure.